friends. Thanks for joining me today. My name is Carla. I am the Director of User Engagement at NeedyMeds, and today I'm going to teach you how to find healthcare savings and other resources on the NeedyMeds website. Before we get started, I'd like to offer a few tips so you can make the most out of today's presentation. First of all, you can ask questions by any time by typing them into the questions section of your GoToWebinar control panel. Just know I will reserve answering questions until the end. If I don't get a chance to answer your question, I will follow up with you by email. I will provide my contact information and the contact information for NeedyMeds at the end. This webinar is being recorded and will be available on the NeedyMeds YouTube channel, which we hope you subscribe to. And you can find a copy of my PowerPoint slide deck and other material I thought you might be interested in the handout section of your control panel. With today's presentation, I'm going to cover what NeedyMeds is, what healthcare savings resources are offered, including the NeedyMeds drug discount card. NeedyMeds also offers other educational resources and cost savings resources that I will point out as well, and we'll show some easy ways to stay in touch and up to date on healthcare topics. So let's get started with what is NeedyMeds. For those of you not familiar with us, we're a national nonprofit founded more than 2 decades ago by a retired family physician, Dr. Richard Sagel, and Libby Overly, who was a medical social worker. Rich is still the NeedyMeds president. This is the NeedyMeds mission statement, a statement about how we achieve that mission, and our vision statement. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through a helpline, 1-800-503-6897, and a website, needymeds.org. So, how do you find these healthcare savings resources on our website? So on needymeds.org, under the Patient Savings tab, you will find all the different categories on ways to save on your medications and other healthcare costs, including prescription assistance programs, our $4 generic drug discount programs, free low-cost and sliding scale clinics, coupons, rebates, and more. You will also find our diagnosis-based assistance programs, the new COVID-19 Resource Center. You can find assistance with medical transportation costs, retreats, camps, recreational programs, and educational scholarships. You can find government programs, and of course, you can also find a link to the NeedyMeds drug discount card. Now, before I move on, I'm going to go ahead and take a moment just to do one quick audio-visual checkup. I'm getting some feedback from an attendee that there is no sound. So for those of you that can hear me, which I hope there are almost all of you, please send me a message in that question section of your GoToWebinar control panel. Great, I'm glad you can hear me. Thanks everybody for letting me know. Okay, so let's move on. So again, you can find the healthcare cost savings resources under that Patient Savings tab. And I highlighted all of the different categories you will find under that tab. So let's talk about what these healthcare savings programs are. At the very top left, you saw a section for prescription assistance programs. Prescription assistance programs are usually supported by pharmaceutical companies and most of the time offer free and some of the time offer deeply discounted prescription drugs, usually name brand to those that qualify. Basically, if you're looking for help affording a brand name drug, begin your search here as prescription assistance programs offer the most savings. Underneath that, you saw a link, and we came so close to making it through the presentation without my dog barking. I apologize for that. So underneath that prescription assistance program section, you will find the $4 generic discount drug program section. And that's a great resource for finding generic medications for a discounted price. Now, you may even find your prescription at a lower price than your insurance company, so it's worth checking out. If you're in need of affordable primary and preventive care, Search the free, low-cost, or sliding scale clinic section for convenient locations for medical, dental, mental health, or substance abuse clinics. There are actually more than 18,000 clinics nationwide in this category. You saw underneath that just a moment ago, we also have the coupons, rebates, and more section. This is where you will be connected to discounted over-the-counter drugs, prescription medications, and medical supplies, really with a quick click of your mouse. Now, for help affording expenses related to a specific healthcare condition, visit the Diagnosis-Based Assistance Programs section. For the most part, this section does not include cost savings for medicines. What it does include instead are help with affording other medical expenses, such as help affording durable medical equipment, maybe money to take time off for respite care, living expenses while receiving treatment, testing supplies, or help getting a service animal. Basically, any healthcare related expense that is not medication, you would want to check out this section again, which is the Diagnosis-Based Assistance Program section. As you can tell by the examples I gave, the programs vary greatly in the cost savings they provide for different expenses. Now, if you or your family or your clients or patients have been impacted by the pandemic, visit our new COVID-19 Resource Center. It's right in the middle of the page under that Patient Savings tab. It's full of programs for those experiencing financial hardships and struggling with healthcare expenses due to the COVID-19 coronavirus. Now, as many of us know, oftentimes getting to and from a doctor or specialized facility causes a financial burden. Look for a program that can help you afford medically related transportation expenses under the Medical Transportation section. We also have categories that provide camps, retreats, recreational programs, and educational scholarships. And the government sections underneath those categories is another important destination to search for government-funded healthcare programs in your state. And the government program section also has pretty exhaustive information about Medicare and Medicaid. So do check that out if you are a senior, you have a loved one that is a recipient of those benefits, or of course a client or patient. So let's move on to talk about another way you can save on your medications and other healthcare costs, which is with the NeedyMeds drug discount card. The NeedyMeds drug discount card can be plastic, like a credit card. It can be a paper version, or it can be a phone app. You simply take the NeedyMeds drug discount card to the pharmacy with your prescription and save. Now, I'm sure you've heard of other cards out there, but the NeedyMeds drug discount card is free and anonymous. Confidentiality is guaranteed. There is no registration. There's no enrollment. There are no residency requirements, and this card does not need to be activated. The good news is that it is accepted at more than 65,000 pharmacies nationwide. So the chances of you finding a pharmacy in your area that accepts the NeedyMeds drug discount card is pretty great. The drug discount card can be used to save up to 80% on prescription meds. It can help you save on over-the-counter medications and supplies, as long as they're written as prescriptions, and can even be used to save on human equivalent pet meds. You can also use the card to save 40% off medical equipment. So the big question is, who can use the card? The simple answer is anyone. The only rule is it cannot be combined with insurance. So if you're uninsured, you can use the card anytime. If you do have insurance, you may choose to use the card instead. And you may do this, for example, if you find that your medication isn't covered under insurance. Maybe you have a copayment or deductible that's too high. Maybe you find yourself in a coverage gap or have exceeded a cap for drug coverage for the year. So let's talk about how you can get your drug discount card and tools to maximize savings. On the NeedyMeds.org homepage, click on the Get Your NeedyMeds Drug Discount Card box with the red arrow on the left-hand side. you will be directed to our drug discount card page. On this page, you can print out a downloadable PDF version of the drug discount card. You can download the app for free using Google Play or the iTunes App Store. You can request we mail you a plastic card by filling out a form, or you can mail us a self-addressed stamped envelope. Of course, you can always reach out to our call center counselors, and they would be happy to drop one or a few in the mail for you. Now, at the bottom of this drug discount card page, you will also find the pharmacy search. Just type in your zip code to see what pharmacies in your area accept the Needymeds drug discount card. Under the pharmacy search, you will find the drug pricing calculator. This is where you can find out how much the drug will cost using the Needymeds drug discount card. The idea is that you will have your drug discount card, know what pharmacies in your area accept it, and how much your medication will cost, an estimate of the cost, using before you head out the door. So again, if you do have any questions about the drug discount card, Needymeds in general, or anything I've covered to this point, don't hesitate to send me a message in that questions section of your GoToWebinar control panel. For now, I'd like to move on because we also have other helpful websites that I'd like to bring to your attention. You can go directly to findcare.org, type in your zip code, and find affordable clinics near your home. Check out safeneedledisposal.org, which is a site dedicated to the safe disposal of home-generated used sharps or needles. And on bemedwise.org, you can find accurate, up-to-date, and useful information on the safe and appropriate use of medicines, safe storage of medicines, and the safe disposal of unused medicines. As promised, I wanted to offer simple ways to stay in touch with us. So on the the top right hand of our homepage, you will see a bunch of icons. You will find links to our Facebook and Twitter pages. Next to those is the YouTube icon. And again, I hope you subscribe to that because it's a great way to keep up to date when new content is added. We post all of our webinars, presentations, and videos to YouTube. Next to that, you will also find a link to our LinkedIn profile. Now, next to that LinkedIn icon, you will find a link to our blog, the NeedyMeds Voice, where you can read timely, provocative pieces on healthcare-related topics. And you can also follow us on Pinterest and Instagram. Now, other ways to stay in touch, click on that Advocates tab, which is right next to the Patient Savings tab. Here you will find our subscription services where you can order print materials such as our drug discount cards and brochures and sign up for email alerts about program changes. You can also share or print many of our most popular brochures. Under that Advocates tab, you can also sign up for upcoming webinars, our monthly e-newsletter, Vitals, and learn about becoming a Needymeds Volunteer Ambassador. If you represent a group or organization, check out how Needymeds can create a customized drug discount card with your business's name and logo, free of charge, and learn about other partnership opportunities. I do hope to see your name pop up as an attendee on future webinars. Again, you can find those upcoming webinars under the Advocates tab on the homepage under the calendar of events. And speaking of webinars, here are the upcoming ones we hope you join us for. In a moment, I do see some questions that came in. We're going to get to those questions. And again, if you do have a question, you can type them into the questions section of your GoToWebinar control panel. But before I answer your questions, I want to mention that today is Giving Tuesday. Giving Tuesday was created in 2012 as a simple idea, a day that encourages people to do good and has grown into a global movement that inspires hundreds of millions of people. I'm thrilled to let you know that many of you have already participated in Giving Tuesday by pledging a donation on this webinar's registration form. We will certainly be following up with you regarding that, but it's fantastic that I have an opportunity to say to you, thank you so much. And for those of you that would like to participate, there's a few ways you can do that. You can make a donation of time by coming on board as a NeedyMeds Volunteer Ambassador. You can make a donation of money by contributing with a financial donation in support of our mission. But because we're living in the times of a pandemic, you can also support NeedyMeds by visiting our new Masks Make the Difference website and purchasing a mask. On this site, you can buy a 3-layer premium quality 100% cotton fabric mask to help keep you and your loved ones safe during the time of COVID-19. The masks are long-lasting, washable, and reusable with antimicrobial treatment. NeedyMeds logo and the Masks Make the Difference slogan on the mask show your support of NeedyMeds and your belief in the protection of masks. We are asking for a $25 donation, but if donating is a hardship, we'll send you a mask at no cost to demonstrate how strongly we feel about the effectiveness of masks. So please consider supporting NeedyMeds today for Giving Tuesday by coming on board as a volunteer, making a donation, or grabbing a mask. So let's get to those questions coming in. And as I do so, I want to leave up our contact information. On the top left-hand side of that screen, if you are interested in ordering one or a few bulk supply of our drug discount cards and most popular brochures, you can reach out to my colleague Alana at NeedyMeds.org. If you have any questions about this webinar, don't hesitate to shoot me an email at carla@NeedyMeds.org. And of course, our call center counselors are available Monday through Friday, 9 a.m. to 5 p.m. Eastern Time at 1-800-503-6897. We do have Spanish-speaking counselors. And as you can see from this presentation, NeedyMeds.org is full of information. So I encourage you to browse the site further when time allows. I'm going to go ahead and leave up that contact information for you. And while I do that, I'm going to go ahead and get to some of those questions coming in. So the first question coming in is, you mentioned you can use the NeedyMeds drug discount card to save on pet meds. How? Actually, we put together a less than 10-minute video on how to use the NeedyMeds drug discount card to save on your pet meds. You can go to the NeedyMeds YouTube channel and type the word pets into the search bar, or you can email me and I'll be happy to send you a link. The most exciting thing about that video is you can see a picture of my dog Benjamin that interrupted us in the beginning of the webinar. So another question coming in. What time is the NeedyMeds call center open? Thanks for asking that. It gives me an opportunity to remind everybody that we did spend all of today going over the website and how to find what you need on the website. But please don't hesitate to give our call center counselors a call, or just remind your loved ones, your patients, or your clients that there is a live person available to help them at 1-800-503-6897. NeedyMeds headquarters is in Massachusetts, so we are on East Coast time. Again, it's 9 to 5 weekdays. And again, we do have Spanish-speaking counselors. So let's see, we have a question coming in about patient assistance programs. One of our audience members says that the majority of prescription assistance programs state you cannot have any other government insurance, and that beneficiaries on Medicare have problems in paying, but they usually are not eligible for prescription assistance programs. So that is often true. What the statement that I will make is it is common for a prescription assistance program eligibility requirement to require that a person either have no insurance or that they're also not using another program. But what I really want to stress is when you look for a drug and you find that that drug has a prescription assistance program on NeedyMeds.org, the prescription assistance program page will come up. On that page, you will find all of what we feel is the most pertinent information, including a section called Eligibility Requirements. The eligibility requirements will show you in a snapshot what the requirements are for the person to be able to apply. Oftentimes, although eligibility will vary from program to program, it is based on three things: whether or not the person has insurance, whether or not what the person's income level is, and what the person's U.S. residency is. Really importantly, what I want to stress is, in addition to that information being there, at the top of that page, under the name of the sponsoring program, you will find their contact information. So if you do have questions about the eligibility requirements, don't hesitate to reach out to the program directly. And although our audience member rightfully pointed out that many of these programs will not help or will make those that are Medicare recipients or have insurance ineligible, the requirements do vary from program to program. So I think it's worth checking out what the program eligibility requirements are, because you never know. It does change from program to program. The other thing that we recommend is that if your client or yourself or a loved one falls outside those eligibility requirements, especially when it comes to the income guidelines, we actually recommend applying anyway and asking the program to make what is called an economic hardship exception. At that point, if you're still denied, you can always formally appeal. So that's an answer to the first part of the question. The second part is, are there other options to assist those in this category? That category being people that are having difficulty affording brand name medications but are not eligible to prescription assistance programs. And I would say yes, there are a bunch of other options. First of all, don't hesitate to check out that coupons, rebates, and more section. I would also suggest checking out our diagnosis-based assistance section, because there may be a cost savings program related to a specific diagnosis or even that medication. And at the end of the day, if we're not able to connect you to an actual cost savings program, I would recommend finding out how much the drug would cost using the NeedyMeds drug discount card instead of the insurance. We have found that 5 to 10% of the time, the NeedyMeds drug discount card will offer a better rate than insurance. So again, it's worth checking out. Now, if you can't find any of this information on our website or feel overwhelmed, again, don't hesitate to reach out to our call center counselors, because that's what they're there for. So let's see. We have a great question about people interested in signing up for future webinars. I love that question. So there are two places on needymeds.org where you can see our upcoming webinars and register for them. Under the Advocates tab on needymeds.org, which is the one right next to Patient Savings, under that you will find NeedyMeds, the link to NeedyMeds webinars, and it'll give you it's a long page of all of the upcoming webinars. It'll give you a title of the webinar, a description, and most importantly, a registration link. When you register, you will get a confirmation and then 2 reminders. You can also find upcoming webinars on the bottom right-hand calendar of events. So let's see, I got a question from another audience member about, can people with Medicare Part D apply to prescription assistance programs? And the answer is, it depends on the supporting, it depends on the organization or business supporting the program. Some will let you apply, others will determine that on a case-by-case basis. The good news is you will see the answer to that in the eligibility section of the prescription assistance program listing on our website. So check that out. So let's see. We have another question about, can anyone use someone on Medicare? And I think we're talking about, can anyone use Needymeds? So the answer is Needymeds. Keep in mind, Needymeds is not a program. Needymeds is a listing of cost savings programs that we connect people to for free and anonymously. So what I would say, and the answer is yes, anyone can reach out to Needymeds by visiting our website, needymeds.org, or calling our call center counselors at 1-800-503-6897. Our goal will be for free and anonymously to connect that person to a cost savings program that will help them afford their medication or other healthcare expenses. I think the easiest thing to do, again, is reach out to our call center counselors because they really can exhaust all options for you. Thanks to those of you that are interested in learning more about the NeedyMeds Volunteer Ambassador Program. I will happily send you some more information via email after today's presentation, but thank you. So somebody's asking for more information about our diagnosis-based assistance programs, and I will happily give you more information about those. So under the Patient Savings tab on NeedyMeds.org, all of those different categories of cost savings programs will pop up. I think there's just under a dozen. In the center section, you will find a link for diagnosis-based assistance programs, and those are pretty popular. I would say right after prescription assistance programs, diagnosis-based assistance programs are the second most searched for destination on NeedyMeds.org. Now, if you are looking for help affording expenses related to a specific healthcare condition, you'd want to visit the diagnosis-based assistance programs. Now, for the most part, this section doesn't include costs for medications. What it does include instead are other medical expenses. So what I mean by that is, let's use diabetes as an example. I like to use diabetes as an example because not only is it such a common diagnosis in our country, but people that are diabetic, needing to afford medication, they often also need to purchase other healthcare related supplies. They may need testing strips. They may need needles or syringes. They may need assistive technology. So there are a ton of medical expenses that people need and have trouble affording that don't fall neatly under the category of medications. I just use those examples for something a diabetic might need. But other medical expenses that are not medications may be durable medical equipment. Maybe somebody needs to take time off and needs some extra money for respite care or living expenses because they're receiving treatment. Maybe they want help getting access to a service animal. So basically, any healthcare related expense that is not a medication, you want to check out that section. So again, under that Patient Savings tab, visit Diagnosis-Based Assistance Programs, and you can search by diagnosis. When you find your diagnosis, the results will pop up, and on the right-hand side, all of the programs that are national will be listed first. And what that means is, regardless of where the person lives in our country, he or she will be eligible to apply. And then the rest of the programs will be listed alphabetically by state. I hope that clears it up. We have a really robust diagnosis-based assistance program section. So I absolutely would say check out that section. Even if you didn't come to NeedyMeds, the website or call our helpline because to search our diagnosis-based assistance program, I would say search it anyway. And the reason I say that is because there may be a cost savings program that can alleviate a burden on your budget that you didn't even know existed. So please check that out. So I hope if you have any questions, certainly don't hesitate to submit them, again, by typing them into that questions section of your GoToWebinar control panel. You will all receive an after the webinar survey, so please let me know what you thought of today's webinar. There is room to leave some comments, so please be vocal about what you thought about today's presentation. With that, I want to thank you so much for joining us for today's Giving Tuesday overview webinar, and I hope you found it useful. And we also certainly hope you follow us and stay in touch through social media and join us for future webinars. With that, stay safe, healthy, and enjoy the upcoming holiday season. Thanks, everyone. Take care of yourself.